Hello, my name is Dr. Denny and welcome back to the Antalgic Trak training series. For our next demonstration, Dr. Bass will show a cervical decompression treatment.
We have our patient on the Antalgic Trak. We have the forehead and supplemental straps securing her head into the cradle. We have the chin strap holding the 4 other straps in place. And now I'm going to set the parameters for treatment. I come over to my screen and I'll touch the cervical therapy button. I will set it up with a poundage setup, so I'll use the force button. Right now, as the patient is lying here, there's approximately 18 pounds of pull on the headpiece, partially because her body weight is pulling downward on the headpiece because of the angle she's on. I'm going to raise the headpiece, and while I raise the headpiece, the poundage will increase. When it comes up a few pounds, I will teach that amount. Here we go. And now we're up to 24 pounds. If I go a little bit more, 25, and I teach it. Then I drop down to release that pull, and I teach that. I go to my standard therapy. I will set the time for 1 minute for a demonstration. I'll have the machine pull for 3 seconds and release for 3 seconds. Keep in mind, all these parameters can be changed to whatever the patient needs. There's no one set pattern. I'll hit the start, and the machine will begin to calculate. It will pull at the 25-pound mark and release to the 19-pound mark. I could also change the poundages and the dwell times while the session or during the session. So I could raise the dwell time to 4 seconds pull and 2 seconds release. Typical cervical sessions might be 20 to 30 seconds of pull with a 10-second release. Poundages may be anywhere from 22 pounds to as high as 40 pounds, in some cases a little bit higher. So when this session is complete, in another 10 seconds or so, you'll hear the session end bell, and what we'll do is at the end of the session wait for the machine to finish cycling. And there's the bell, and it's in the middle of a cycle. It now completed the cycle. We come back to our start screen, but to release the patient, the first thing I want to do is just lower the headpiece a couple of millimeters, and then I release my straps. I'll take my chin strap off, and I make sure that I'm not moving the patient's head around or jarring them around. I hold the head firmly so the patient is comfortable. And then I would bring the patient up and take them off the machine like this. I ask the patient not to lift their head. When the spine's gone through, or the cervical spine's gone through decompression, you have to help acclimate the facet gliding. And we do that by simply, now you may lift your head upward, the patient's in neutral. You just help the patient rotate somewhat, laterally flex, extend and flex. And now the patient is free to move their head. To take them off the table, we'll once again lower our seat. Hold the patient's hand, help them rotate off the machine, and that concludes a cervical session.